everyone, and welcome to the fourth of our webinar series, looking at mobilising evidence and organisational knowledge. And our fourth webinar is going to be focused on a retrospect. What is a retrospect? How can you run a retrospect? Learning more about it. So I am Sue Robertson. I am Knowledge Services Development Lead for Health Education England, working across the South, and I'll be facilitating the session today. And Alison Day, who is the lead librarian in Bournemouth and Poole, but also Knowledge for Healthcare Project Manager, will be running the training. Now, everyone is muted for this session to cut down on background noise. Now, as you are all muted to cut down on the background noise, that doesn't mean to say that we don't want to hear what questions you have. But if you've got any questions, again, you can see on the right-hand side of your screen, there is a chat facility. The presentation will last about 30 minutes, and it is being recorded, and we are uploading both the PowerPoint presentation and the recording onto the Knowledge for Healthcare blog, and I'll send you a link to that after our session today. But before we start, I'm just going to ask you a couple of questions. But I can see from this that for our first question, have you ever taken part in a retrospect or a retrospective review? 16 out of 19 of you haven't. One person has, and a few haven't answered. But the vast majority, 18 out of 19 of you, have reflected on an activity to help you learn from what has taken place. So I am now going to hand over to Alison. So that does take a few minutes while I pass the presenter ball to her, and then Alison will lead us in our presentation today.
That's lovely. Thank you so much, Sue, and thank you everybody for taking part in the poll. Interesting. I think probably the majority of us have all done some form of reflection, and that's a really good skill for being able to do a retrospect, as we will find out. So as Sue mentioned, we're going to have a little look at what a retrospect is, why we may want to use it, and when we may want to use it. Consider the steps involved in carrying out a retrospect and what we're trying to do in each of those steps. And also a little reflection on how it's different from perhaps an after-action review, which some of you may be familiar with. We'll have one discussion element, and we'll have one activity which we can actually use to explore retrospect in a little bit more detail. So let's get started with what is a retrospect? So we've got our person stood there looking at the reflections in the water, looking back, and it is about looking back near the end of a major project and reflecting upon the learning that has arisen from the project before a project team disbands. Usually at the end of a project, can be at the end of a project stage. So if you've come to the end of a particular piece of work, you want to get everybody together to really see what the learning was from that to perhaps then inform the next stage of the project or indeed a new project. So that's what a retrospect is. And there are several reasons for why you might want to do a retrospect. The first is to identify learning from a longer-term project. Really can consider what were the contribution to success or failure. Can you make some recommendations about what led to success or failure for this particular project? And then to share that information, to share those recommendations with other people to inform future projects and initiatives. And it's really to help, the added advantage is it helps the project team to have a greater insight into their future work. So it's about looking in detail across all the relevant project activities that could be done to improve results in the future. And then you can put that into a project, into a knowledge resource or a knowledge asset that can be shared with others to inform new projects and initiatives. So fundamentally, a retrospect is a structured, facilitated session, and it's got four very distinct elements, and we'll look at those in a moment. There will always be a facilitator. Usually the facilitator has not previously been involved in the project, so they come to it new. And it's usually very helpful to have a rapporteur to capture the notes and the key outputs from the retrospect. And I think these two roles are where library and knowledge service teams can probably offer the most assistance with a retrospect. The facilitator helps the team to reflect on their work and analyse why things did or didn't go well and formulate recommendations for the future based upon these. They help the team to remember, to discuss, to analyse and to agree. And those are the four key elements, really, of a retrospect. So thinking about who is involved in a retrospect, it really should involve all the people and key stakeholders who are involved in the initial project. They may be an internal team. It may involve suppliers from outside. So, it can be quite a large process in terms of the participants. But it is suggested, I read on the UNICEF document, and I've got a reference to that at the end, that 12 is an optimal number of people to be involved in a retrospect. And if you have more than that, you might do the introduction and the wrap-up with the larger group, but the detail you may want to do into smaller groups. So you may want to hold what we would call sub-retrospects, again with separate facilitators and rapporteurs, so you can really drill down and gather the information that's needed, the knowledge that people have gained through the process. It's also advised to invite a couple of observers who will be beneficiaries from the learning outputs from the retrospect. This helps to sharpen the focus of the recommendations and to really keep in mind who's going to be benefiting from this information in the future. There are times when you may not want to use an observer or not want to invite observers, particularly if you don't want to inhibit any free sharing of experiences. Perhaps if a project didn't quite go to plan, the results weren't as you wanted, it may be having an observer in the room may inhibit the responses. So you may have to have a word with if you are facilitating, you may have to have a good conversation with the project lead to decide what they want and what their feeling would be about having observers as part of the actual retrospect. So moving on, I said there were 4 steps to actually carrying out a retrospect, and I'm just going to go through those very briefly now for you, just to give you a feel of how a retrospect would actually run. So the first step is really about scoping out what the project was trying to achieve. And the aim here is really to identify where the key learning is. So you're trying to ask participants to state what they set out to achieve during this project or this stage of the project. And then you want everybody to agree on those objectives and then to consider whether the objective was achieved, whether it was underachieved, or whether it was overachieved. And a good way of doing this is to use flip chart paper and to actually list each objective and then to make notes as to whether it was over, under, or whether it was a tick to say it was actually achieved. What you're trying to do in this stage is really just set the scene. You're trying to re-gel the participants as a team, help them to remember what happened, what it was they set out to do initially, and help them to analyse. Sometimes in this stage it can become clear that not everybody in the team fully understood the objectives, and that's a learning process in itself. The second step of the retrospect is then drilling down in a little bit more detail, thinking about what were the successes of this project, why were they successful, and how can others repeat that success. This is all about identifying good practice. And one way of being able to do this is to ask each participant to write a sticky note with the work area that they're looking at, the key success related to that work area, and what their recommendation would be to replicate that success. Those sticky notes can then be clustered together, and the whole group can then have a read of those, analyse them, agree whether they are recommendations, and then gradually those recommendations start to fall through to form the knowledge asset that you hand on to the next team that comes along. To help with this analysis, you might decide to use something like the 5 whys technique. Keep asking why until you get to the root cause of why this was a success. Sometimes people will present this on a fishbone diagram, which some of you may be familiar with. And root cause analysis is used a lot within healthcare, so that will be quite familiar to people within healthcare. The third step, very similar to step 2, except this time we're looking at the disappointments. So what could have been done better? Thinking about the causes and agreeing the actions to avoid these disappointments in future. At this stage, it's a good idea to remind all the participants of the scope. Go back to those objectives and remind people that we're only looking at disappointments in relation to whether or not we have achieved those objectives. That's very, very important to stay very focused and get very sharpened recommendations based on the objectives of the project. The final step is really a wrap-up. And a nice way of being able to do that wrap-up is perhaps using a bit of a priority tool, which is giving marks out of 10 for the project as a whole. What would have, and really thinking, looking back, how satisfied are you with the activity outcomes, and giving this a mark out of 1 to 10. And then people may then perhaps score it an 8, thinking, well, yeah, it was okay, it was all right. So then you come back and you say, okay, what would have made it a 10? And when they give you that feedback, those are the key sort of recommendations that perhaps you can put into action straight away, because they're the very sharpened learning that you can take away from a retrospect. They are the highest priority learning elements. At this stage, it's also sometimes quite useful to say, is there anything else that still puzzles us? Is there anything we haven't quite got to the bottom of? Not to solve at this stage, but just to have as questions. People sometimes find that quite uncomfortable because they want to really be able to provide very positive recommendations and not to have any unanswered questions. But for the next project group that comes along, the unanswered questions could be the most helpful. So that is a useful stage. What you're doing in this wrap-up with your participants is agreeing the key learning and the key recommendations to take forward. So those are the 4 steps that I've gone through. What I'd like to do now is I'll set up a whiteboard in a moment, and I'd like to encourage you all to either use the whiteboard or the chat facility to just tell me what you think you would need for a retrospect to work effectively. What would you need to establish for a retrospect to work effectively, particularly if you're facilitating? What sort of things do you think should be put in place? So we'll just spend a few moments. There's the whiteboard. To use the whiteboard, if you click, you should have a toolbar along the top, and there should be a T that you can click on. If you click on that T, which is the text tool, and then move to some white space on the board, you should then be able to click and type a response. I'm just going to try that now just to see if that works for me. So, lovely. I'll read out some of the things we've got. So I've already got some responses. So for a retrospect to work effectively, what do you think needs to be established? Time, ground rules, absolutely crucial to have some ground rules, open-ending questions, and understanding that it is for forward planning, very critical. Purpose, absolutely. This is not just a broad conversation. This is very structured. Confidentiality, one of the ground rules. Trust, absolutely essential. The right people at the meeting, absolutely. And no blame culture, again, critical. Participants will need to know what is to be discussed in advance to give them time, and I've run out of the text on there, but to give them time to think. So, yeah, I think that's absolutely right. But remember, people will have been involved very closely in this project. These are people who are coming to this project having been immersed in it for a long period of time. There's some good suggestions there, which I think absolutely are critical. Something else that somebody's put there is respect for each other, which, again, I think is really important. Let's see if anything's come through from the chat window as well, actually. I'm just opening up my chat window now. A suitable venue, no interruptions. I think that's really important as well, just so that, you know, it's a good protected space to do this piece of work. And yes, somebody's put, there's a facilitator, you need to do your homework in advance to understand the project. And certainly one of the tips is if you don't need to be immersed in the project, but you do need to have some understanding. Otherwise, as a facilitator, you can't actually understand what people are talking about. So actually some time in preparation with the project lead to just understand what the project was about, give you an overview, can help with that facilitation. Lovely. Okay. Thank you for your responses. We'll just go back to the presentation. So some of the things that I've come up with very much match what you had identified. So trust, no blame, openness, the need to share, time to undertake. A retrospect can take anything between 2 to 4 hours to all day, depending on the complexity of the project. It's absolutely critical to make sure that people know it is not a performance review or an audit. The emphasis is the focus on learning, and ground rules are critical. Everyone has to have a voice, and there is no hierarchy. And it's really important to stay focused on the process and results and not on the roles of individual people. It's not a blame game. So a few tips for the success of a retrospect. As I've just stated, ensuring that everybody knows beforehand that it's a time for learning. Sometimes useful to be really clear that the assumption is that everyone did as well as they could in the situation they faced. That's how you come into this process, with that understanding. If you try and use a retrospect for performance evaluation, it will fail. It's really not designed for that. It's really about a time for learning and passing those recommendations and that learning on. It's a good idea not to delve too much into very micro-level lessons. We want to try and keep quite a broad, long-term focus on this process. And the idea is to identify improvement areas which are specific and actionable. So, you really need to hone in and get very specific and actionable recommendations at the end of this. The conversation must stay focused on process and results. Everyone has to have an opportunity to talk. And if a project succeeded and a project team leader wants to learn and share and the project team communicates well and there's a good morale within the team, it will probably be quite easy to undergo this process. If only some of those things are in place, it may be more challenging, and a wider range of facilitation skills will then be required. So a retrospect within the knowledge management framework, the NHS knowledge management framework, is regarded as a learning after activity. And in the knowledge management toolkit, which you can find on the Knowledge for Healthcare blog, you'll see it fits into two areas. It's regarded as sharing learning and also as connecting people to knowledge or to the evidence base. This is really about knowledge sharing to spread learning. So another tool which we often use during a project is an after-action review. And retrospect and after-action reviews are quite complementary. The same facilitation skills are at use, the same reflective style is at use, but an after-action review takes place during a project rather than at the final end. And it focuses on very specific activities to gather short-term learning and develop quick corrections to practice. So you can make a quick tweak or a change as you're going along, having conducted an after-action review. The after-action review structure, which you can have a look on the Knowledge Management Framework postcards, and the link is at the bottom of your screen there, is a really useful tool. I've used it quite a lot following learning that I've done, or if I've delivered a training session. So that standard sort of evaluating your own practice, is quite useful in that sense. But also, I've known people who've used it when they've come back from conferences as a way to consolidate the information they've maybe gleaned from a couple of training sessions or a workshop that they've attended at a conference. After-action reviews tend to be less formal, and they have very brief action plans. And if you're doing it collectively with the project team, that tends to be shared just with the project team, not necessarily outside into the wider community. So more information on actually how to do an after-action review, as I said, is on the postcard. But both do tie in quite neatly together, and it's worth looking at both when you consider retrospect. So just a very brief recap. Not quite finished the presentation yet, but we've got an activity next. So hopefully I've managed to explain what is meant by a retrospect and why it may be useful. I've outlined the 4 steps involved in conducting a retrospect and thought about what is required for a retrospect to be successful. We've thought about some tips to help facilitate a retrospect, and hopefully I've explained a little bit about how a retrospect is different to an after-action review. So I thought we might have a go at a final activity, and we'll see how this works. But I mentioned in step 4, when you do the wrap-up in the retrospect, it's sometimes useful to use a project rating tool to actually prioritise the learning and the recommendations. And I thought we might have a go now at actually doing that for this presentation. So it's a slightly false use of the tool, but it will give you a feel for how it may work. So what I would like you to do in a moment is think about this webinar and rate how well you have felt the learning objectives have been met on a scale of 1 to 10, where 1 is low and 10 is high. In a moment, I'll put up a whiteboard, and I'd like you to write the number that you feel you would give this webinar, and alongside that number, then write what else you would have liked to have had included to make this a score of 10, and then just pop your initials along the side. So I'll just put the whiteboard up, and I'll just repeat what I'm asking you to do. Give it a number, a scale of 1 to 10, on how well you feel the learning objectives of this webinar have been met. And then alongside that, say you gave it an 8, consider what would have made this a 10 for you. What's missing that would have made it a 10? And then just pop your initials alongside. Okay, thank you. So I've got one response, which is given it an 8. And so it would be nice to have looked a little bit more at root cause, which is a separate tool in its own right. So we'll look at that and see whether we can send some information through about how to do a root cause analysis. Okay, so I've been asked to remind you about the learning objectives. So they were to understand what is meant by a retrospect and why it may be useful, outline the 4 steps involved in conducting a retrospect, thinking about what is required for a retrospect to be successful, considering some tips to help facilitate a retrospect, and explaining how a retrospect is different to an after-action review. So I've got a 7, some examples of findings. Okay, thank you. A 9, an example template for turning into a knowledge asset. That would be useful, and with one of the references at the end, there is a knowledge asset that you can have a look at. Help to have the learning objective listed before the session to consider. Okay, that's something we can maybe put into our future webinars. With the knowledge asset, I think we have a webinar about knowledge assets coming up in the future, so it'll be a separate session in one of our series, so you'll be able to find out more about knowledge assets then. How in practice a librarian would become involved. I think that would be useful. I think the key there is really that they would become involved as a facilitator. I know some colleagues at NHS Digital have done a lot of work with retrospects and actually helping to set up retrospects and actually facilitating retrospects and then developing the knowledge assets. Okay, a video clip of the facilitation process, interesting. And again, more about involvement of library or a librarian, okay. So thank you for those responses. That's really helpful, and I think there's some things there that we can take forward as well for our future webinars. So just to help you, I'll just go back to the presentation again. Just to help you to think about a retrospect and how the process works, rather than going off and running a full retrospect, you might want to just think about a piece of work that you've been involved in, and just from a personal point of view, or you could do this with a team, identify one success and just identify one disappointment, and then to put each of those as a recommendation that is specific and measurable, and then think about one person who may be able to benefit from that knowledge. So that's just something to maybe think about and go away and do in your own time. So lots of extra information to help you with this. I've noticed there's an error on the first URL, so I will correct that in the slides before they get sent out. But you've got examples of using Retrospect within the Health Library Service in the Knowledge Management Toolkit, so worth having a look at those. There is the postcard, which is really helpful and gives lots of tips on the 4 steps and how to run the 4 steps. So if you were doing the retrospect, it's quite useful if you're facilitating just to have that to hand. There's a really good piece of e-learning available, which again goes into a little bit more detail about how you would facilitate a retrospect. And the UNICEF, so UNICEF have produced a knowledge management toolbox, and the section on retrospect goes again into quite a lot of detail about how you could run a retrospect. And they use a case study at the end to illustrate how it's been used by UNICEF, which is quite illustrative. So I'd encourage you to take a look at that. And then if you wanted to see or hear somebody's experience of being involved in a retrospect, there are 2 videos. One, somebody who's been directly involved in a retrospect. This is somebody from a health perspective, and then somebody who's been an observer of a retrospect. So again, they may be quite useful to look at. So really, it's just over to you to see if you had any questions about retrospects, if there's anything that you wanted to ask, and I can try and answer those to the best of my ability. I'll give a few minutes for any questions to come through. Oh, Sue.
There's been a couple, Alison.
Lovely. Okay.
That I've seen so far. So one about a practical question. So if you're writing a report up after a meeting, how long does it take? So what are the practical timescale implications here?
Okay. So I think the first thing to say is it's not a report, it's a series of recommendations. You're not trying to record everything that happened in the project. That's not the purpose of the retrospect or passing on the knowledge. The purpose is to pass on the learning, the recommendations. So on the UNICEF resource that I mentioned, which I certainly found quite helpful, there was an example there of how you can package the outcome from a retrospect. And it is quite brief. I'm just trying to find it. I've got it here in front of me. And I'm just trying to pull off the question so I can show it, not show you, but can talk it through to you. And it really is just a 1, 2, 3, 4, 5. It's a 5-stage report. And I think the idea is to keep it brief because you don't want a great, long, wordy document. You want this to be quick, bullet point learning lessons for people to take away. There isn't an idea of how much time it would take, but I guess it depends how quickly you can gather that. Obviously, the point of having the rapporteur there is to capture everything that's said, and sometimes it's useful to capture that as a video clip or an audio clip, and then you can include that within the lessons learnt as another option for doing that. But certainly I would recommend having a look at the UNICEF guidance and having a look at their meeting record, which is quite brief. It's just got a couple of headers and it really isn't very lengthy or detailed. Obviously, it depends how complex the project is as well that you're carrying out the retrospect for.
Okay, thank you. And then there have been a couple of questions relating to how library and knowledge service staff can be involved. Mm-hmm. So what do you think are the benefits to library and knowledge service staff participating in a retrospect?
Okay, well, this is a personal view rather than anything that's been published, but my view is that it gets you involved in some essential work and spreading the learning around essential work in the organisation. So I think it raises the profile of what we do and the work that we get involved with. I think that we've got the skill set in that we're good facilitators, that we have the connections across the trust, that we're quite neutral, which I think is useful if you're going to be facilitating a retrospect. Other benefits, I think people get to know you so that when they then start and embark on a new project, they may come to you early on for evidence or knowledge to support a new project starting, and that may be a before action review. I don't know whether it happens to others who are on the call, but often I will get people come to me towards the end of a project saying, oh, can you find some evidence to support the work that we've done, which seems slightly the wrong way around to me. It would be much nicer if they came to us early on in the project and then we could actually get involved at an early stage, understand what they're trying to do, and provide a better level of service in terms of providing relevant evidence to support them in their work. And I think if we've been involved in a retrospect, they automatically then recognise us as those people to go for, to get the evidence, to get the knowledge, to get the lessons learnt, to inform the next project as well.
Excellent, thank you. And you may have covered this in your previous answer, but it's a bit about selling the library and knowledge services staff skills as a facilitator. I don't know if there's anything else you wish to add to that.
I think it's possibly twofold. I think we've mentioned the facilitation skills. In terms of selling that, I think you sell it by doing. I don't know quite how you would sell it otherwise, but I think you probably have to persuade people that you have these skills and you're willing to go in and you have a process that you can follow. You understand the tool, you understand how it works, and that you can go in and run this for people in a structured way. Particularly if perhaps they have got a large retrospect to do and they need some sub-retrospects running, because actually they probably don't always have enough people to be able to come in and run sub-retrospects. So we've said 12 is an optimal number. If you can imagine there were sort of maybe 24 people involved in a project and they had different strands, it may be useful for us to go in and just run a smaller facilitation with a smaller number of people. The other thing I think we can sell is the fact that we are trained to package and present information in a way that makes sense to people and organise that information. That's more about what we do with the output from the retrospect and how we put that and create a knowledge resource or knowledge asset. But again, I think we've got skills there that we can actually arrange those materials in a way that makes them easy to reuse. So that would be something else to emphasise. And one could argue it's easier to do that if you've been involved in actually facilitating the retrospect, because you understand where the information came from initially and you can put it in a context or in flows in a way that would make sense to other people.
Thank you. And there's a couple of questions still on facilitation. So somebody's asking if you can recommend any facilitation training, and I know that here in the South we've had that, haven't we? So it may be a question of going back to your lead, wherever you're based. But I don't know if you've got any particular recommendations about facilitation training.
I don't. I mean, one of the things that I've done is I've agreed to be a Leadership Academy 360 degree appraisal facilitator, and that was quite useful because that involved a degree of e-learning and face-to-face facilitation training. So that might be one way you could do it, and you've then got the added benefit of being able to offer that to your organisation as well, to be an accredited 360 appraisal facilitator. We will be looking at identifying some additional facilitation training. If I find anything, I can send through links to e-learning. I'm sure there's quite a lot out there, but I think, as you say, Sue, maybe going back regionally and seeing what's available as well. But that may be a question I'll come back to if I can find useful things to point people to.
Yeah, we can certainly share what... Yeah.
I was going to say, I'll have a look in the learning zone as well and see if there's actually anything within the learning zone on the Knowledge for Healthcare blog. And if there isn't, we can make a recommendation there to identify some facilitation training materials that might be helpful for people.
Excellent, thank you. And what do you think are the key facilitation skills?
Oh my, okay. Well, I think as we covered in previous webinars when we were talking about knowledge harvesting and peer assist, I think it's really probably the skills of being a good listener, open-ended questions, giving people space and time to talk, setting those ground rules and making sure people are holding on to the ground rules that we discussed earlier. I think those would be essential. But what I think you're probably trying to do as well is use a variety of tools to encourage participants to do that process of sharing and analysing and really understanding and agreeing recommendations. So anything that will help you to draw people out and to draw people's opinions. So that may be using sticky notes and getting people to write things. It may be having an open floor event and encouraging people just to talk and share their experience. It may be about keeping a balance within the room and the voices within the room. So I know I've heard of some places where people use what they call a talking stick, or they hand around an object, so only the people with the object can speak, as a way of making sure people don't talk across each other. So general sort of facilitation skills like that, I think. But the key really of the facilitator is to sort of open up and encourage those learning lessons to be drawn down and formed into recommendations. So keeping that at the heart of what you do is probably critical. You're not having a general discussion about the project. You've got something very specific that you want at the end of this. And as facilitator, that's what you're trying to keep people on course with and achieve at the end.
Brilliant, thank you. Now, there's a couple more questions. Do you have any, or do you know of anyone who has had any experience of being asked to provide information as a result of a retrospect? For example, we learned this, we'd like to learn more about that. I don't know. Got any practical?
Personally, I don't. But I could imagine that when people come in and are starting out on a project, if you've been involved in a retrospect, you've produced the knowledge asset, you will be able to see that then as another resource that you can pull on as a piece of evidence that can inform the next piece of work. So, you know, as you may get asked for a literature search to see what published evidence has been produced or what best practice is happening elsewhere in the country, you may then be able to also call on results on lessons learnt from retrospects to actually inform the next piece of work, as well as doing a formal literature search. I know some people have started experimenting with putting lessons learnt on their library catalogue, for example. So that might be an example of how that could be shared or found or used. As we know, recently, San Unambawe at Brompton Hospital has won the Sally Hernando Award for developing an innovations database. And again, that could have lessons learnt within it, so people would go there and have a look and draw down that information to inform the next project that comes along.
Yeah, and I know a number of institutional repositories are broadening out and including that stuff as well. And then I think this is the final question, but it is a bit more of a comment. We know it's difficult for NHS staff to find time to take out of their busy, clinical managerial environment. So do you think it may be difficult to get people to attend a retrospect?
I think it depends on what it is that you're looking at with the retrospect. This is very much around a specific piece of work. So you wouldn't do a retrospect for day-to-day learning and day-to-day work. This is about thinking about my own example within Poole Hospital, not that I've done a retrospect with them, but the team I would approach is that we've got a team that every couple of months will run a process looking at flow through the hospital, and they'll put various measures in place to try and improve the flow through the hospital. That's a specific time-limited piece of work that a specific group of people are involved in. And as part of that, because they want to learn lessons from what they've done, they would then dedicate the time, because this would be seen as part of the project. So I think you would get people to engage in this because it would be seen as part of the project or part of the piece of work, the initiative that they're experimenting with. This isn't just something that runs as an add-on to the day job. And that's why I think you would get people who would be able to give time to this.
Yeah, so it's mapping out what's happening in your trust already.
Absolutely.
Where you can add value
to
something that's taking place rather than...
Yeah.
Excellent, okay. I don't think we've got any more questions, but I'll give a couple of moments if anybody wants to send something through. Thank you, Alison. I think you answered those really well, and thank you for giving us a greater understanding of the difference between a retrospect and an after-action review, and the ways that we can use the skills that we have to facilitate this when we come across those opportunities. So thank you.
Lovely. Thank you, Sue. And thank you, everybody, for listening and joining in. Just to remember that our next WebEx is at 10 a.m. on Tuesday, the 17th of October, when we'll be joined by Helen Bingham, who'll be looking at helping people to keep up to date and exploring alerting services. So I hope you can all join us for that one.
Yeah, and Helen will be helping us understand what's happening nationally around alerting services, so that's good. Yeah, we're getting loads of thanks, Alison, so thank you for your training and enabling us to understand a little more. And as I said, post-meeting, I will send out a link via the Knowledge for Healthcare blog, and the other webinars are there and available for you to look at. So thank you. Speak again soon.
Thanks, everybody. Goodbye.